All right, good afternoon. My name is Josh Priestley at TPC Benefits, and we work with John Lee at Urology Centers of Alabama on the health insurance and benefits. This is going to be a quick view for the Urology Centers of Alabama employee benefits that go into effect January 1st of 2024. You can use this overview throughout the year to reference your benefits. Secondary insurance is going to remain the same secondary insurance benefit that we have right now. It's going to be the Alliance Secondary Insurance. It's going to be the same deductible of $500. You will have to pay that first $500 before you gain access to that $6,500 bucket of money that's going to pay your calendar year deductible, your co-insurance, the emergency room costs, the outpatient physician and facility costs, the inpatient physician and facility costs, labs, pathology, diagnostic tests, ambulance, durable medical equipment, chiro, physical therapy. What does the secondary insurance not cover? The secondary insurance does not cover the office visit copays, so you will continue to pay the office visit copays as usual. The secondary insurance does not cover the pharmacy copays either. You will continue to pay those pharmacy copays. The preventive care is covered by Blue Cross Blue Shield at 100%, so the secondary does not need to pay that. Any elective medical procedures, say somebody wanted to have plastic surgery, elective, plastic surgery. Well, Blue Cross is not going to cover that, nor will the secondary insurance not cover anything elective. There is no network for the secondary insurance. The network for the secondary insurance is Blue Cross Blue Shield of Alabama because it piggybacks off of the Blue Cross Blue Shield network. If it's a covered charge by Blue Cross Blue Shield of Alabama, then the secondary will pay every single time. If it's a non-covered service by Blue Cross, where Blue Cross says this covered service is just not flat out not covered, well, the secondary would not pay. If Blue Cross covers it, the secondary insurance will cover it. The secondary insurance excludes home health care treatments. It also excludes mental, nervous, and substance abuse. There are no pre-existing conditions for the secondary insurance, and the provider files the claims. This is going to be the Blue Cross Blue Shield plan in the dark blue, and in the light blue is going to be the secondary insurance plan. Your major medical plan is both plans combined. So it's a two-card system. You have Blue Cross Blue Shield as your primary health insurance for one card. You lay down that card, and then the provider photocopies both sides of the Blue Cross Blue Shield card and stores that in their system. Then you have the secondary insurance card. You lay down that secondary insurance card along with your Blue Cross card. They photocopy both sides of your secondary insurance card and store it in the system. The providers will file the claims for both Blue Cross, as they always do, and the secondary insurance as well. There is a $500 deductible on the secondary insurance. You just have to pay that $500 deductible just one time for the employee only. If it's employee only coverage, you have to pay that $500 deductible once. If you have employee, spouse, or family coverage, you have to pay that deductible of $500 twice. Then you gain access to the $6,500 for the employee only. If you have family coverage or employee spouse coverage, the employee will have a $6,500 bucket of money, and then the spouse will have a $6,500 bucket of money. If it's you, your spouse, and your kids, you will have a $6,500 bucket of money as the employee, and then the spouse and kids will have their $6,500 bucket of money as well to pay for those out-of-pocket expenses related to this Blue Cross plan in the dark blue. The Blue Cross plan has a $6,000 deductible, but we have a $6,500 secondary insurance benefit that covers all that deductible and a portion of the co-insurance, because the secondary insurance even pays the co-insurance. So with the two plans combined, your deductible is essentially $500 because our major medical plan is both plans combined. Our out-of-pocket maximum is $8,500. Once an employee reaches their out-of-pocket maximum with Blue Cross Blue Shield of Alabama, Blue Cross covers every single covered service throughout the rest of the year, even copays, prescription drugs, everything. We have a $6,500 bucket of money that will cover 8 $6,500 of the $8,500. So worst case scenario, you would pay $2,000 in $1 million claim. Worst case scenario, you would owe $2,000 before your out-of-pocket max is reached, and then your plan becomes 100%. Your office visit copays for primary is $40, $60 for specialist. Everywhere in the plan that says 100% coverage, 100% coverage. Blue Cross pays all that. The secondary doesn't pay. Blue Cross pays everything, and you don't even owe one penny for anything that says 100% coverage. So for labs, pathology, chemo, radiation, x-rays, testing, and IV therapy, all that's covered at 100%. Down here, for the outpatient facility and physician, labs, x-rays, and pathology is covered at 100%. Everywhere you see 6,000 CYD, 6,000 CYD, 6,000 CYD, 6,000 CYD, that's where the secondary insurance pays after you pay your $500 deductible once, and then boom, you gain access to the $6,500, which will cover the rest of your deductible and a portion of the coinsurance. The prescription drug copays is $15 for generic drugs, tier 1. There is a $250 deductible, calendar year deductible, that you have to pay once the first time you go to the pharmacy in 2024. You got to pay the $250 deductible, then you gain access to the $60, the $100, and the $425. You only have to pay that $250 drug deductible once. After that, you have access to these copays of $60, $100, $425 for tiers 2, 3, and 4. Here's some claim examples. As you can see, we have a $6,500 bucket of money. This claim is going to be $5,700. You only have to pay the first $500 because that's your secondary deductible, and the two plans work in conjunction with each other, the Blue Cross and the secondary. The secondary pays $5,200, and then Blue Cross pays the rest. Example number 2, outpatient surgery, torn ACL. This claim is like $6,500, $7,000. Again, you have to pay your $500 deductible. If you haven't already paid it, if you've already paid it, you don't have to pay it again. It would be $0. And then the secondary pays the other $5,400, and Blue Cross pays the rest. Durable medical equipment, CPAP machine, is $3,000. You got to pay your first $500 deductible. If it's already paid, you don't have to pay it again. And then the secondary pays the other $2,500. This is the worst case scenario for a $93,000 claim. For a $93,000 claim, you're going to hit your out-of-pocket maximum of $8,500. And so what's going to happen is the secondary insurance pays this $6,500. You pay your $2,000 because the difference between the out-of-pocket max is $2,000. So $2,000 plus $6,500 that the secondary paid is the out-of-pocket maximum. Once you reach your out-of-pocket maximum, you can have all these claims over and over and over, and Blue Cross pays everything and you don't pay one penny. Everybody will get a Blue Cross Blue Shield card if you made changes to your plan, add a dependent or drop a dependent. If you didn't make changes, you'll continue to use the same Blue Cross card. Everybody will get a brand new secondary insurance card because we are changing secondary insurance vendors to Optimed. Optimed is the new secondary insurance carrier that goes into effect January 1st. It's going to have your name, the group number, the member ID, the customer service number on the front, and the benefit amount. The back of the card is at the bottom, and that's going to be how to file the claims. What you really need to focus on is that QR code. That QR code, you take your phone out, hit the camera button, scan it. That QR code is how you access your telemedicine. The telemedicine benefit is a link that you can access through the QR code. You can register over online for the telemedicine. It's a $0 copay. You can talk to an in-state licensed physician over the phone, and they can diagnose and treat, send a prescription to your pharmacy. This is your Blue Cross Blue Shield portal. This portal is very important because this is how you can review claims, track your deductible, and print off claim statements if there's ever any claims that are in question. My office can work on these claims for you if you have issues. There's a secondary insurance website that you can track your secondary insurance benefit at www.secondaryhealth.com. This is going to be the telemedicine. Again, it's a $0 copay, unlimited consult visits, and you can talk to that in-state licensed physician over the phone. And you can call them for anything. If they can treat it over the phone, they will treat it over the phone. If they cannot, they'll be like, hey, we can't treat it over the phone. You need to go to your primary care physician. But this is a good first line of defense because it's a $0 copay for you and your family. You do have to register and activate your membership. There's going to be 2 ways to register and activate your membership for your telemedicine benefit. Again, you can talk to this doctor while you're sitting on the couch watching TV, and they can diagnose and treat, send prescription to your pharmacy. The way you can activate your account is online by scanning that QR code, clicking the link, and then register, logging in and register and answering the health questions. You have to answer health questions with the telemedicine because they don't want to prescribe you something that might harm you. After you answer the health questions, then you can talk to a doctor. You can also call the number 866-226-1033, and you can activate your membership over the phone and answer those health questions. This is going to be the dental insurance. The dental insurance is going to remain the same. It's going to be Beam Dental. So the same dental insurance plan that you have now will stay in force. It's going to have a $25 deductible for the individual, $75 for the family. That $25 deductible is waived for preventive care. So for those cleanings, x-rays, fluoride treatment, space maintainers, and sealants, you don't have to pay a $25 deductible. You just walk in, walk out, and then Beam covers everything. The basic services, that's even covered at 100%. So lab tests, cavities, root canals, denture repair, extractions, oral surgery, anesthesia, that's all covered at 100%, which means Beam will pay the maximum of $1,000. The maximum benefit that Beam Dental will pay in a year is $1,000 towards dental work throughout the year. Major services is covered at 80%. That's going to be a cost-sharing mechanism where you would owe 20% for bridges, dentures, crowns, inlays, onlays, implants, and perio. So if you get a bill for some dentures that are $100, you owe $20 and Beam pays the other $80. There's an orthodontia benefit of $1,000 that's covered at 50%. So the max they would pay is $1,000. Those are going to be the rates on a monthly basis. This is the vision insurance plan. It's going to be VSP. Even though Beam is the insurance company, the actual network is VSP. So all you got to say is, I got VSP. It's the best network in the country, and every provider is going to be in it. There is a $10 copay for exams, $10 copay for materials. The frequency for your vision plan is 12 months. That is a rolling 12 months. So if you pick up single vision, bifocal, trifocal, or lenticular lenses, say on December 1st, well, next December 1st is a rolling 12 months, and you will be eligible for those frames again and lenses the next 12 months. Frames is $150 retail allowance, and then 20% off the balance. So if you get really expensive glasses and they're $500, VSP Beam would pay $150. There would be a $350 balance, and then you get a 20% discount off that $350 balance. Contacts are covered in full if they're medically necessary. If contacts are medically necessary and the doctor says you cannot wear frames at all, you can only wear contacts, that would be medically necessary, and those contacts are covered in full. If you can wear frames or contacts, either or, then you get a $150 retail allowance every 12 months for those contacts as well. Those monthly rates are below. This app is incredible. I have this app. It can store all your Blue Cross information on it, your cards. You can check claims, check pharmacy networks. You can check who's a provider with Blue Cross Blue Shield of Alabama. You can track your dependent information at the Alabama Blue app. So download the Alabama Blue app, register, and then all your information with your Blue Cross plan will be in that app. There's going to be a QR code for Apple and Android if you want to go that route. There's going to be some wellness tools powered by WebMD that you can access through your Blue Cross app and through the website at alabamablue.com/mybluewellness. You can take health assessments read up on daily habits, and a personal health record, accessed all through this website. Also through My Blue Wellness at your service at the same website is going to be care reminders that you can access. If you need assistance or scheduling appointments, you can call that phone number. They can help you out. There's health coaching programs as well. Sometimes life, it gets busy and you don't take your health seriously. Through the health coaching program, you can access different programs to reach your goals and overcome the barriers of staying healthy. And these programs are all on the app as well. Also on the app and the website is Baby Yourself Maternity Management. If you need support and encouragement through the maternity management program, there's chronic condition management that you can also reach out. Say, for example, asthma, coronary artery disease, COPD, diabetes, heart failure. You can talk to that professional over the phone and they can help you with resources. There's Blue 365 as well that you can access through the app or the website, where you can get hand-picked deals from premium brands that help your employees receive discounts. There's going to be better discounts for healthier savings programs, exclusive offers through Blue 365 year-round. The Hartford Insurance benefits is going to be benefits that's offered by Urology Centers of Alabama. And these benefits you can take advantage of. That's going to be the group life insurance, the short-term disability insurance, the long-term disability insurance. You can purchase additional life insurance via payroll deduction at higher limits through the Hartford. There's going to be an accident plan through the Hartford, a critical illness plan through the Hartford, and a hospital indemnity plan as well that you can purchase. That would work in conjunction with your secondary insurance and your Blue Cross plan. Note that little star right here and here would require evidence of insurability if you sign up for those coverage, which means you have to answer health questions. There's a new EAP program through CompPsych. This EAP program is available to all full-time employees, and you can speak to a confidential counselor over the phone or have 5 face-to-face meetings, sessions at no cost to you to address stress, work stress, relationship matters, other personal issues that you and your dependents may face. You have a guidance counselor that you can speak to over the phone or set up 5 face-to-face visits for stress, anxiety, depression, job pressures, relationship, grief or loss, problems with children, substance abuse, or anything you need assistance with. They also have certified public accountants and certified financial planners that can help you get out of debt, plan for retirement, get out of credit card debt, talk about loans, potential loans, existing estate planning, tax questions, and savings for college. This EAP program can be accessed at 1-800-327-1850. You can call that number, give them that web ID, or you can do it online at guidanceresources.com and register online. There's your web ID to activate that. We talked about this also with that EAP program is Guidance Resources Online. You can access different guidance resources online to help navigate through life. There's legal support and resources. You can talk to an attorney by phone for 30 minutes for free. Maybe divorce and family law, real estate transactions, debt and bankruptcy, civil and criminal actions, and contracts. It's all available on 30-minute free sessions for an attorney through this EAP program. Work-life solutions, child and elder care, college planning, moving and relocating, pet care, major medical purchases, and home repair. Home care navigation is also through Health Champion that is a part of the EAP program. This is a definitions page that can help answer questions about health care, your Blue Cross plan, and your secondary insurance plan. I appreciate your time, and I hope you have a great 2024.